Okay, nice to meet you.
Thank you.
Please, what is the name of the mosquito that transmits malaria parasite?
The female Anopheles mosquito.
We have mosquito, the female Anopheles mosquito.
Okay. What is the causative organism for malaria?
Oh,
Male Anopheles mosquito. Okay, you.
she's correct. Female Anopheles mosquito.
Mention a symptom of malaria.
Headache.
Fever.
Symptom of malaria, fever.
Another symptom of malaria could be headache or nausea.
Mention a drug which can be used to treat malaria.
Artemether and lumefantrine.
The drug, you can use fancy that.
What drug?
You could use chloroquine.
Artemisinin and lumefantrine.
Okay.
Pyridoxine and artemisinin.
Mention a risk factor of malaria.
The risk factor.
Mention a risk factor of malaria. Okay, Daniel, can you please mention a risk factor of malaria?
I said this girl.
Genotype. Genotype. Yeah. Which of these statements is the most painful to you? It is over between us. I cook, but you don't finish. Transformer don't blow. You sure say na here you plug your phone?
You sure say na here you plug your phone? You know how much for gadgets now? Phones and everything. Very expensive.
You sure say na here you plug your phone?
I think he's on about phone.
Yes. And the transformer don't blow to his painful.
You sure say na here you plug your phone? I don't want any pain part.
You just say na here you plug your phone.
It's the most painful.
Yes.
Sure, say na here you plug your phone.
I cook, but you don't finish.
You sure say na here you plug your phone?
You just say na here you plug your phone.
Transformer don't blow, man.
Hello there, welcome to the health show. I am Inwetinya Favor and we'll be talking about malaria today. First of all, what is malaria? Malaria is a mosquito-borne protozoal infection which infects the red blood cells. It is also the leading cause of death in many developing countries, subtropical countries and also tropical countries. So firstly, we'll be looking at what organism causes malaria. The causative agent of malaria is Plasmodium species, and we have different Plasmodium species which are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and the most common Plasmodium species which is known for causing malaria in Africa and Nigeria is the Plasmodium falciparum species. Many of us know malaria is caused by mosquito, but do you know the particular mosquito which causes this malaria or transmits the parasite from one person to another? Let me tell you, it is the female Anopheles mosquito. So what are the signs and symptoms associated with malaria? If you have malaria, what are the signs you need to check out for in yourself or for your patient? I'll be listing some common signs and symptoms associated with malaria today. Number one on the list, we have fever. Your body gets hot all over. Pains, your body aches, you have waist pains, chest pains, general body weakness, fatigue, yes, nausea and vomiting. Chills down your spines too. There are some risk factors also associated with malaria. That is, people who are more predisposed to getting malaria. Topping the list is pregnant women. Women who are pregnant are actually more prone to contracting malaria. We have children. Children have weakened immune systems, so they are also more prone to contracting malaria. People with compromised immune system are also prone and predisposed to contracting malaria. And also, unclean environments where you have stagnant water in your gutters, waterlogged areas, uncleared grasses. You have to clear your grasses regularly to not have a breeding site for these organisms, mosquitoes, to breed there. You may wonder why people with genotype AA are more predisposed to having malaria than people with AS or SS. And I'm sure you must have seen trends with now AA people go they sick and all sorts of that. I'll be telling you why in this video. This is actually because the malaria parasite actually thrives on red blood cells, and a patient with genotype AA actually has a good red blood cell structure which provides a breeding place for the parasite to grow and develop all the stages of malaria. But for sickle cell patients, their blood cells, as you all know, is sickle shaped. So even if the person gets malaria from the mosquito and the parasite gets into the red blood cells, it cannot actually thrive in such conditions. making AA more disposed to having malaria. In case you find yourself, your friends, or relatives presenting with these signs and symptoms which I have just listed, you can contact a certified pharmacist in your area nearby. Thank you for listening.
What is diarrhea?
Diarrhea is a gastrointestinal disorder that's characterized by excessive bowel movements, can lead to stooling, frequent stooling.
Diarrhea is a state of increased GI motility, increased bowel movement.
Diarrhea. Diarrhea is a medical condition whereby the stool it's very watery.
What are the symptoms of diarrhea?
Okay, symptoms of diarrhea: dehydration, excessive stooling, loss of strength, that's fatigue, you know, and then maybe headache sometimes can be part of it.
Okay, please can you spell diarrhea?
Okay, Diarrhea.
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 Diarrhoea.
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 Please, what's the most common anti-diarrhea drug?
Loperamide.
Loperamide.
As an antibiotics or as in
Anti-diarrhea.
antidiarrhea is probiotics.
Loperamide.
Okay, is metronidazole an anti-diarrhea or an antibiotic?
Metronidazole. Okay, anti-diarrhea antibiotic. It's an antibiotic.
Metronidazole. Metronidazole is an antibiotics.
Metronidazole, I think, is both basically, but it depends on like the indication of the particular disease you're trying to cure.
Okay, please, what's the difference between diarrhea and dysentery?
Diarrhea is watery stool. Then dysentery is watery stool with blood. Like that's bloodily watery stool.
Dysentery is a form of diarrhea. When there's blood in the dysentery, in the diarrhea, they call it dysentery. That's what I know.